Could what's showing up on your face be a direct result of something that you're eating? When it comes to gluten, that's a definite yes. I'm Dr. Robynne Chutkan, gastroenterologist, microbiome expert, and author, and I am here to help you find gut bliss. You wake up in the morning and look in the mirror, and you almost don't recognize yourself. Your face is puffy and swollen. You have new blemishes that seem to have sprung up overnight. Your cheeks are red and blotchy, and you have dark spots on your chin. It looks like you've been binging on alcohol and salt, plus have a bad sunburn and are broken out. But the only thing you did was eat a bowl of pasta yesterday. Could gluten, the protein in wheat, rye, and barley, have something to do with what you're seeing in the mirror? Before we dive into what's commonly referred to as gluten face, let's take care of a few housekeeping details. The first thing I want to talk about is the difference between celiac disease and gluten intolerance. Celiac disease is an autoimmune disorder, and it's caused by gluten, the protein found in wheat, rye, and barley. The hallmark finding of celiac disease is damage to the lining of your small intestine. The villi, the finger-like projections that absorb nutrients, are atrophied. They're shrunken with celiac disease, and there is also an increase in inflammatory cells in the lining of the small intestine. And celiac disease can cause a wide variety of symptoms, including things like bloating, abdominal pain, diarrhea, constipation, a change in weight. It can cause weight loss, but also weight gain, fatigue, anemia, rashes, joint pain, neurological symptoms like brain fog, other autoimmune phenomena, or no symptoms at all. So that's celiac disease. Gluten intolerance, which is sometimes called non-celiac gluten sensitivity, can cause similar symptoms to celiac disease, but it isn't an autoimmune disorder, and there's no actual damage to the lining of your small intestine. We diagnose gluten intolerance based on your response to removing gluten from your diet. Or sometimes you take the gluten out and you really don't notice much difference, but it's when you reintroduce it, the symptoms all come right back, that it's then very obvious that you are sensitive to gluten. In addition to GI symptoms like bloating and gas, we see a lot of non-GI symptoms with gluten intolerance, things like rashes and brain fog, behavioral changes, joint pain, fatigue. Some people discover they're gluten sensitive or gluten intolerant, same thing, when they're experimenting with low-carb diets to lose weight. And sometimes, in addition to losing weight, they notice that their skin improves when they stop eating gluten. Now, there can be other reasons for that too, because a lot of these low-carb diets, in addition to excluding gluten, also exclude processed food and dairy and refined sugar, and these are all things that can mess up your skin. But coming up, I want to share with you what is specifically known about the effects of gluten on your skin and appearance. The Gut Bliss podcast is brought to you by VisBiome, my first and quite frankly, my only choice for a probiotic. Whether you're dealing with irritable bowel syndrome or just looking to restore your gut health, VisBiome can help. It's a medical food for the dietary management of IBS and gut inflammation. Backed by science and clinically vetted by thousands of my own patients. Find your gut bliss with VisBiome. Go to visbiome.com/gutbliss and use discount code GUTBLISS at checkout. The classic skin condition in celiac disease is a rash called dermatitis herpetiformis. And dermatitis herpetiformis, we call it DH for short, affects between 10 and 20% of people with celiac disease. It's a chronic, itchy, blistering skin condition with clusters of small papules and vesicles on the elbows, the knees, the buttocks, the back, the scalp, and the face and groin can also be affected. When DH occurs on the extremities, on the elbows and knees, it's usually symmetric, so you see it on both elbows and both knees. And DH is an external manifestation of an abnormal immune response going on in your gut to gluten. And what happens with that abnormal immune response is that IgA antibodies, immunoglobulin A antibodies, form against proteins in the skin. When you eat food that contains gluten, your immune system activates and it produces these IgA antibodies, these immune complexes that get deposited into your skin. And it's these immune deposits that cause the itchy bumps and blisters that are characteristic of DH. But DH isn't the only skin condition we see in people who are sensitive to gluten. If you have celiac disease or gluten intolerance, studies show that you are also at higher risk for skin conditions like eczema, rosacea, psoriasis. These are all skin conditions that I discussed in my gut skin series a couple episodes ago. Chronic dry skin, acne, hives, vitiligo, and alopecia. These are all skin conditions that are associated with celiac disease and gluten intolerance. And research shows that a large percentage of people who suffer from these conditions will find relief when they eliminate gluten from their diet. But in addition to these more classic autoimmune skin conditions like vitiligo and psoriasis, there's also a syndrome that's referred to as gluten face. A typical gluten face has red, puffy cheeks with spots of hyperpigmentation, especially on the chin, and some people will also have pimples around the chin area in the lower part of the face. And the face in general looks bloated and swollen. Now, what is causing those changes? Gluten has been shown to increase the inflammatory response, and that inflammatory response can show up on your face, making it look bloated or puffy because of the fluid retention that accompanies inflammation, and also creating pigmentation issues that we can also see with inflammation, like age spots and dark areas. And yes, the solution, if you have gluten face, is obviously to go gluten-free. But the trick is not to eat gluten-free products. And I'm going to explain why in just a minute. Switching from gluten-containing products to gluten-free equivalent products is a terrible idea. Why? Because gluten-free products use chemicals and synthetic substances to try and reproduce that doughy, gluten-like quality that is, so delicious and so characteristic of actual gluten-containing foods. So those gluten-free equivalent products are typically full of emulsifiers like soy lecithin and carrageenan and other substances, chemical substances, in this quest to reproduce a gluten-like feel in a gluten-free food. And those substances all have a negative impact on your gut and many of them on your skin. So what I recommend as a rule of thumb is if a food says gluten-free on the package, don't buy it. Just put it back. That is typically going to be on the label of things like bread or pasta or cookies or frozen pizza or waffles and other ultra-processed foods. Now, if you buy gluten-free bread at the farmer's market, like I often do on a Sunday, that is a freshly made gluten-free bread that was made in a bakery. It's not frozen. It's not a long shelf life product. And yes, it does have some stuff in it, but that is going to be far less objectionable than a packaged, processed, frozen, or long shelf life gluten-free food. But what I want you to keep in mind is that a bag of rice or a pound of sweet potatoes is not going to say gluten-free on it. So avoiding gluten-free packaged foods is critical, especially if you're trying to improve the appearance of your skin. Because again, it's not just the immune-mediated inflammation from gluten. These other food-derived chemical ingredients can also cause an inflammatory response. Another question that people often have is, if you don't have celiac disease, but you're gluten sensitive and you think you may be suffering from gluten face, how much gluten can you get away with? How much gluten can you safely eat? Is there a small amount that you can eat and not worry about? The answer to that question is your body is going to tell you. I know in the case of my husband, and he doesn't have gluten face, but he has eczema that is very clearly connected to gluten. And I talked about that connection between his eczema and gluten a couple of weeks ago in episode 12. And for him not to have an eczema breakout, he has to be around 80% gluten-free. Once regular gluten starts to creep into his diet, his eczema definitely starts to flare up. So what I recommend is 100% elimination for a couple months to get things under control. If you are just experimenting with this and you're noticing the bloated, swollen face, the hyperpigmentation, the redness, and so on, and you think that gluten may be the culprit, I want you to completely eliminate gluten from your diet for a couple months. And then once your skin is looking better and feels more healed and less inflamed, you can try reintroducing a little bit of gluten to see what your threshold amount is that you can tolerate. Now, if you have celiac disease, 0 amount of gluten is what you should be eating, because ongoing exposure to gluten in someone with celiac disease, even if they don't have any symptoms at all, even tiny exposures to gluten, if you have celiac disease, can cause damage to your gut lining and can eventually lead to more worrisome things like anemia and arthritis and even some types of cancer. But that is only in people who have celiac disease, not in people who are just gluten sensitive. So now that you know the difference between celiac disease and gluten intolerance and how both of these conditions can impact your skin, I want to leave you with 3 takeaways about gluten face. Number 1, if you have noticed skin changes that you think may be related to gluten, try completely eliminating it from your diet for a couple months and see if those changes improve. Number 2, once your skin has healed, if you're missing the gluten, you can try reintroducing small amounts to see what your threshold is for tolerating it. Most people don't have to be 100% gluten-free to see results. Now, of course, if you have celiac disease, you do have to be 100% gluten-free. And number 3, don't fall into the trap of eating gluten-free products like gluten-free bread, pasta, cookies, pizza, waffles. Those foods are full of emulsifiers and other chemicals that can also mess up your skin. So that's it for this episode of the Gut Bliss Podcast on gluten face. Coming up next week on the Gut Bliss Podcast, the first in my series on the gut-brain connection. The Gut Bliss Guide to Healthy Skin is a whole new approach to improving the health of your skin from the inside out. Over 70 pages of detailed information, including a product ingredient guide, skincare recipes you can make at home, a nutrition plan that tells you exactly what to eliminate and what to add in, plus my favorite green smoothie recipes that will have you glowing. You can find it all at gutbliss.com under Gut Guides. Go to gutbliss.com for my free 7-day microbiome reboot course. If you like what you're hearing, drop a review and hit that subscribe button. And remember, dirt, sweat, vegetables, the best prescription for a healthy gut.
The information presented in this show is not meant to be medical advice. Consult your doctor before making any decisions about your health. The patients discussed are real people, but names and identifying features have been changed to protect their privacy.